Hi everyone, this is Rumana Janat from Group 1 Tuesday 1 p.m. tutorial. Our research topic is continuous glucose monitoring device for type 1 diabetes. Type 1 diabetes is an autoimmune disease that destroys insulin producing beta cells in the pancreas, leading to insulin deficiency. It is more frequently diagnosed in younger individuals and accounts for 5% to 10% of diabetes causes globally, with a prevalence of 9.5% and an incidence of 15 per 100,000 people. As its prevalence raises, millions require lifelong insulin therapy. However, continuous glucose monitoring devices are compact and wearable tools that track glucose levels day and night, altering users when levels are outside a set range and indicating trends. These devices improving glycemic control, with studies showing that intensive management can reduce complications by about 60%. The target blood sugar level is between 4 to 8 millimole per liter to avoid both hyperglycemia and hypoglycemia. I'm going to focus on Dexcom Generation 6, the most popular device in the market. The Dexcom Generation 6 device eliminates the need for finger stick calibrations, providing a less painful and more streamlined experiences. It measures glucose levels every 5 minutes using a sensor placed just beneath the skin, lasting up to 10 days without replacement, and transmits readings wirelessly to a receiver which will be compatible with smart devices. In addition, an iOS or Android smartphone is needed to view real-time glucose data and upload information to Dexcom Transparency. Also, transmitters must be replaced every 3 to 12 months, with the Dexcom Generation 6 needing a replacement every 3 months. It is also compatible with the Tandem insulin pump and MyLife Ipso pump.
Continuous glucose monitoring devices have proven highly effective for managing diabetes in Australia. They allow patients to monitor glucose levels 24/7, showing a record of temporal trends and patterns. Patients can also set individualized alarms which alert them if glucose levels are not within a safe threshold, prompting timely intervention and minimizing hypoglycemia. Several both randomized controlled trials and meta analyses have found the use of CGM to be superior to the traditional self monitoring of blood glucose in terms of glycemic control. One of these meta analyses included 21 studies and 2,149 participants and found that the use of CGM was associated with lower blood glucose levels and greater glycemic control. Another clinical trial found that some additional benefits included decreased time spent in a hypoglycemic range, a reduced number of hypoglycemic events, and improved well-being and patient satisfaction. Continuous glucose monitoring devices are generally considered safe, as they offer a minimally invasive way to monitor blood glucose levels without the need for frequent finger pricks. However, as with many medical devices, there may be risks, which in this case include skin irritation or sensor inaccuracies, although these are typically very rare. In Australia, individuals with type 1 diabetes can receive either a full or partial subsidy for CGM devices from the National Diabetes Services Scheme. Prior to this subsidy, the cost of CGM was around $4,000 to $5,000 per year. Eligible individuals must benefit from the technology and be willing and able to use it and participate in a diabetes treatment management plan. Individuals eligible for a full subsidy include those under 21, women who are pregnant, and those over 21 with concessional status. All other patients can receive a co-pay subsidy, which includes a fully subsidized device initially and then is followed by a monthly cost of $32.10 for the Dexcom G6.
Whilst the contributions of CGMs in the monitoring of type 1 diabetes must not be discredited, there are ethical implications to be considered prior to the standardization of CGMs in diabetes management. In countries without a subsidized scheme, out of pocket costs can economically marginalize T1D individuals into those who can afford CGMs and those who cannot. With this, the standardized treatment of diabetes shifts with the socioeconomic status of the individual. This disparity in treatment in the healthcare system promotes stigmatization around CGM use, as those unable to access them may be perceived as having a poorer socioeconomic status. Dexcom CGMs have continuous access to a range of personal and health-related data, even going as far as the user's online activity before, whilst using, and after leaving their products and services. This may infringe upon the user's ethical right to informed consent, as they may not fully understand the purpose and extent of this data collection. The policy also states that this anonymized data can be shared under legal obligation, thereby exploiting ethical concerns of data privacy, security, and ownership, as the users lack control over their own information. This lack of informed consent in data collection and distribution to third parties directly undermines the agency of T1D individuals. Additionally, CGMs can also impede the autonomy of users, with constant alerts and notifications dictating where, when, and how they manage their disease. This ultimately diminishes the capacity and freedom of T1D individuals to make independent decisions regarding their own health.
Current continuous glucose monitors face issues such as lag time and sensor wear time. The 5 to 20-minute lag time between ISF and blood glucose levels can lead to complications during rapid glucose changes, necessitating frequent calibrations with traditional blood glucose tests. Sensor time is another challenge, with replacements often required every 7 to 10 days, causing discomfort and increasing costs. To combat these issues, biorecognition and anti-biofouling technologies have been developed to extend sensor lifespan by mitigating foreign body responses such as inflammation and biofouling. Looking ahead, the future of CGMs lies in the integrated closed-loop systems with insulin pumps, creating an artificial pancreas. These systems use real-time CGM data to calculate and deliver insulin automatically, ensuring glucose levels remain within the ideal range. In summary, continuous glucose monitors are essential for the management of diabetes. Subsidies help with cost, and strict standards ensure that they are safe and effective. The issues surrounding inequity and disparity, as well as the user's lack of privacy and autonomy, are also discussed. Continuous improvements can be made to CGMs to make them more accurate and comfortable, enhancing the quality of life for those with diabetes. Thank you for listening.